Great, thanks for your patience, everyone. We can kick off this session, which is going to talk about ethical aspects of vaccines research. My name's Adam Hacker from CEPI. I'm chairing this with my colleague, and maybe you can introduce the speaker.
Hi, thanks. I'm Simon Drysdale, paediatrician from Oxford. It's a pleasure to introduce Alberto Giubilini, who is a humanities group lead and a philosopher from the University of Oxford. And so he's going to tell us about some of the ethical aspects of vaccine research. Thank you.
Thank you very much. Can anyone hear me? Or is the microphone working? Yes. Well, thank you very much for being here. Thank you for the kind of invitation. So I'm particularly grateful for this invitation because I should also start by disclosing something. Because I know most of you start your talk with disclosing potential conflict of interest. So my disclosure is I'm a philosopher. So I'm not a scientist or a medical doctor. So I work in philosophy and ethics. And that explains why I'm particularly grateful for this invitation. I'm very honored to be speaking here because this invitation suggests that at least some of you, at least the organizer of this conference, think that ethics and philosophy have something else to say about science and research and vaccine research specifically. So I know some scientists are a bit skeptical about that. So to those of you who are supportive of the role of ethics in doing research, I hope this talk will not change your mind. And I also hope to convince those who are more skeptical that there is something that people like me can bring to the discussion about research and vaccine research specifically. Because I should say, I know that quite a lot of scientists see ethics as a barrier to effective, efficient research. And I say that there is something to it, and that's not necessarily a bad thing, that ethics puts some barriers to research. But I also think that some of this perception is due to what I would call an over-bureaucratization of ethics and ethical procedures in academia. I like that some people are nodding at that, which, I mean, this is part of a larger problem with the bureaucratization of academia beyond ethics, but that's a rant for another occasion. So many of you will see probably ethics as a series of bureaucratic procedures, like checklists you have to go through when you design a project. Or maybe in the best case scenario, something like this codified guidelines, ethical code of practice, for example, the Declaration of Helsinki that regulates medical research internationally, with concepts like about human dignity or the importance of informed consent, the duty to minimize risks of harm, and so on and so forth. Now, all these things are very important, but I think there is more to ethics than this. And I think the most important and the most interesting part of ethics is not this. So ethical guidelines or checklists are the end of a process of thinking and reflecting critically about ethical issues, values, and principles that informs the guidelines. But the real ethical work is done when we think critically about principles, values, and how to do research. So what I would like to do in this talk is try to convince you that, first of all, we need more ethics in research. But secondly, the kind of ethics we need is not more principles and guidelines, it's more critical thinking and reflecting about what exactly we do when we think about ethical issues in research. But I do agree. So as I said, I do agree that ethics, when done properly, is pretty annoying sometimes. Because what it means to do research ethically. So what it means to bring philosophy into ethics. So you might, I don't know if any of you have some philosophy background, but you might have heard that some philosophers call themselves or are utilitarian. So I come from England, so England is the land of the nation of John Stuart Mill and Jeremy Bentham. So they invented utilitarianism as an ethical theory, and the idea of utilitarianism is that the ethical thing to do, what you have a moral obligation to do, is maximizing the expected utility. So you have to bring about the most good you can do. In this case, for medical research, it will be maximizing, I don't know, the number of lives you can save in the future by developing effective vaccines, for example. Well, research ethics is not utilitarian because there are many other principles and values that matter and should matter in research ethics, but I should say in ethics more generally. For example, research ethics and vaccine ethics is concerned with things like minimizing the risk of harm, fairness, avoiding unfairness in the recruitment of participants. So once you start taking into account all this principle, that means that, yeah, of course, ethics does and perhaps should hinder medical progress. Because, I mean, to simplify, it's not the case that the end justifies the means. Now, you might say that this is kind of obvious, but I think it's true to me, but I will also say something in a bit that somehow challenges what I just said. Just as a evidence for the fact that doing ethics is not so much about being prescriptive, giving guidelines and principles, but think critically about how we do things. Because even the thing I just said, that of course the end doesn't justify the means, sometimes you might want to challenge this assumption in some context of medical research. But just to illustrate what I'm talking about. So scientists work through scientific experiments. Philosophers often work through what we might call, I know many people will find this concept funny, like thought experiments. Like you imagine case, a situation, and then you want to test your intuition on that. So one thought experiment is often used in medical ethics and research ethics is this one. Suppose you have 5 patients in a hospital. They are sick. Each of them needs an organ to survive, an organ transplant. There are no organs, but you have another patient that comes into the hospital. This patient needs an examination, has some mild disease, but this patient happens to have all the 5 healthy organs that these 5 people need. So you can easily sacrifice the life of one patient to save 5 lives. So 1 life on one side and 5 lives on the other side. Now, ethics, the law, and common sense will tell you that you can do that, right? So that suggests that there are some limits to what you can do to promote the good, the maximum good you can achieve. If, for example, in this case, well, most obviously people have a right to life, so you can't just sacrifice one life. In this kind of cases, sometimes you can, but not in this kind of cases. And medical research is a bit like that. Maybe you can develop safe and effective vaccines that can save millions of lives, but it matters what kind of rights or other principle you are infringing. Maybe not necessarily a right to life, but there are rights and principles that stand in the way. And this example suggests that's how it should be, and it's always helpful to keep that example in mind. Now, what I would like to say is that answering this kind of question, so what kind of rights and principles and duties we should respect when we do medical research, is not a matter of scientific and scientific and medical expertise. So because these questions are not medical or scientific questions, so they are ethical questions. And I should also say, I'm not claiming that ethicists or philosophers have the authority to answer either, because there are a lot of political, cultural, and societal dynamics that determine and should determine the boundaries of legitimate research. For instance, a lot of the ethical guidelines and regulation of scientific research emerge after horrific historical events, say Nazi experiments or experimentation on non-consenting members of certain racial groups, for example. So there is a historical component to why we have certain guidelines and a societal component to it. So the task of ethicists and philosophers, as I say it, is that of helping thinking through the relevant ethical concepts and values and identifying the relevant questions that we need to ask in research. But answering this question is really a broader societal and political task. And it's always a historical situated one. So the ethical guidelines we have today are not the ones we will have in 50 years. They are not the same that we had 50 years ago, for example. For example, because this was mentioned this morning, so we don't have specific ethical guidelines for challenge studies. So the relevant ethical frameworks for challenge studies are the one of vaccine research and medical research more broadly. But challenge studies might require their own specific guidelines, and I will say something in a moment about that. Because, for example, the risks involved are different. Some people say the autonomy of participants enrolling is not the same as in the case of normal trials. So there are all sorts of differences that go with challenge studies, and maybe we need different ethical guidelines for those. But to formulate ethical guidelines, you need to think critically in the way I've just suggested we should do about medical research. Now, so we can, we can summarize what I've just said by saying that there are really 2 ways of thinking about ethics in medical research and in vaccine research specifically. One is what I would call institutional ethics, just ethical codes of practice, guidelines, and so on and so forth. And the other is what I will call philosophical ethics, which is about thinking critically about ethical principles, values, and concepts involved. Now, as I said, I would like really to convince you that doing ethics is really about doing the second thing. Because ethical guidelines are already there. In a way, they're relatively straightforward, applicable, but we need to do more of the second, I think, even to apply the ethical guidelines, because ethical guidelines by themselves are useless if we don't know how to interpret them. But let me say something about ethical guidelines first, because I think, first of all, it's what the organizers had in mind when inviting me, but also these ethical guidelines is ultimately what provides the ethical framework within which scientists will need to move. Now, one thing to notice about ethical guidelines for vaccine research is that, well, they're applying to vaccine research. So you need to have something that counts as vaccine research. That is certain institutional settings and certain types of procedures for ethical guidelines to apply. But historically, that's not always or often be the case. We will not have, of course, many vaccines that we have today if we had always moved into the institutionalized settings of research and we had ethical guidelines since the start of vaccines. Most obviously, you probably know about Jenner's experiments. Some people say Jenner's discoveries were a moment of serendipity. He was interested in doing research around cowpox, and then he found out almost by chance that cowpox, some doses of cowpox would offer protection against smallpox. Then he vaccinated, well, he inoculated the child of his gardener. Completely unethical by current standards, but that's what you had to do to have the vaccine. So if we had had ethical guidelines back then, we would not have had the vaccine. At least we would not have the vaccine at that time, at the point in time, in that way. Now, is this an argument against ethical guidelines, or is it an argument for hindering medical progress? I don't know. I mean, to me, it's a good thing that there are ethical guidelines, but it's important to think critically about their historical dimension and what they can allow us to do and what they can prevent us to do. But taking ethics seriously means, I'm afraid, taking seriously the fact that not all medical progress is morally good, no matter how many lives you can save. But again, I will say something to challenge that. Now, institutional ethics is made of relevant codes of ethics for vaccine research, so relevant codes of ethics that apply to research. But one problem here is that vaccines research is ethically regulated by the same ethical codes of practice that apply to clinical research more broadly. So these codes typically refer to therapeutic clinical trials. They are typically based on, I would say, these 7 principles. We can identify the 7 principles. There should be enough value in the research. Research should be valid, of course, scientifically valid. There should be fairness in selection of the research subjects. There should be favorable risk-benefit ratio, independent review, informed consent, respect for all enrolled participants. This is what ethical guidelines will say. Now, 2 things I would like to notice here. First of all, while many of you will say, well, thank you very much, this is pretty straightforward, common sense, you don't need an ethics expert to say these things. And everyone, no one will deny these things are important, right? But that brings me to the second thing I want to say, is that this thing is not very informative because all these concepts are pretty vague. So what each of these concepts means in principle and in practice is an evaluation. It depends on values, principles. So what it means for research to have value is a judgment we have to make. There is no objective threshold for what counts as valuable enough. Everything is to an extent valuable. Something is very valuable, something less valuable, so there must be a threshold. That's a value judgment. Things like what kind of risk-benefit ratio is favorable, again, is a value judgment. What counts as informed consent also is a value judgment, because we heard a previous speaker question, okay, what it is to informed consent. For example, if you offer certain payment for enrollment in challenge studies, are you undermining autonomy in an important way? We need to think what is autonomy. Well, we should respect patients. I keep saying patients, but participants. Yeah, that's true, but what does it mean to respect participants? So all these things require, I suggest, ethics to be interpreted. So they require some kind of interpretation to be prescriptive. And that is where ethics, in the philosophical sense of the term, the second sense I mentioned, becomes relevant. Not because it becomes itself prescriptive, but because it can help clarify the concept involved so that we can put these concepts into action. Now, this becomes even more relevant if we think specifically about the ethics of vaccine trials and how they're different from the ethics of other types of medical trials, because vaccine trials typically involve healthy subjects, with the exception of challenge studies. I will say something. I mean, they also involve healthy subjects to begin with, but we'll say something about that. They involve very large numbers of individuals. There are certain benefits to participants because so if you test a vaccine, you don't know if the participant will ever be exposed to the pathogen against which you are testing the vaccine. Some people suggest that participants in vaccine research should have higher, or like some financial compensation, because the risk-benefit ratio is not as clear as in the case of normal, like other kind of trials. I don't know if that's the case. I really don't have answer to these things, but the point is that there are these type of questions that need to be asked, and that's where I think philosophical ethics, thinking critically about ethics and concepts and values and principles becomes important. And I'm going to give you here two examples. I'm going to give you two examples of why I think it's important. So I mentioned challenge studies. We heard this morning a lot about challenge studies. I did a bit of work on this, so I don't need to tell you why they are potentially important, useful, effective. Many clinically valuable breakthroughs have been made through challenge studies. But they come with their own specific ethical issues. And because the current guidelines don't address specifically challenge studies, we need to that kind of critical thinking of ethics and philosophy to try to understand exactly, okay, how should we regulate this? When I say regulate, I don't mean necessarily legally, but I mean ethically, so kind of ethical constraints that should be. In an ideal world, ethics and the law go together. That's often not the case. Maybe something for something that shouldn't go together, of course, but that's another topic. So some people, for example, have proposed that participants in challenge studies should be paid additional money for the risk they incur by being infected by a virus, for example. Some people say that might be unfair because you might end up offering too much money, so that becomes a form of undue inducement, or not enough money, and that becomes a kind of exploitation if you expose participants to certain risks without compensating them enough. Something that might undermine autonomy, because you offer someone money to get infected with a virus. People with financial needs might go for that and take on risks that they would not otherwise take. These are all ethical issues. I don't have the answer. I'm just trying to bring up what ethics can do to contribute to this discussion. Now, the relevant ethical frameworks that we usually use for challenge studies are the usual one. The Hippocratic principle, first do no harm. We have the Declaration of Helsinki, contains this principle of the primacy of the human being, saying that the primary purpose of medical research is to generate new knowledge. This goal can never take precedence over the rights and interests of individual research subjects. Various national and international guidelines have adopted these principles, by the way. Now, the question is, do challenge studies comply with these principles? Well, that's an ethical question that requires the kind of critical thinking that I was referring to. So there have been some attempts to provide criteria and guidelines specifically for challenge studies by WHO working groups. Here is one example. But to me, this kind of thing are kind of question begging, because you bring up the same problem. So you should minimize the risk of harm in challenge studies. Well, what kind of level is minimal enough for them to be permissible? You should obtain informed consent. Informed consent is a very complicated topic. It's unclear when, if ever, you can consent informally to anything. But especially when there is, for example, money involved. If someone pays you to get infected with a virus, if you need the money, is that really autonomous decision, informed consent? I don't know. And more importantly, one key concept in vaccine research is that of minimizing harm. Now, the concept of harm, if you think about it, is itself very complicated. So what does it mean to harm? When do you know that a participant in a challenge studies, or indeed any vaccine trial or any medical trial, has been harmed? That's a terribly complicated question. I don't know what it means to harm someone. To an extent, if you find this talk a bit annoying, I'm harming you, so you are harmed. But we can all agree that you can live with that, right? That's acceptable. But then I could do worse thing to you that harm you enough. At a certain point, you say, wait, that's not acceptable anymore. So the same is true in medical research. So everything harms participants somehow, but we need to draw a line, and that's a value judgment where you draw the line. So what it means to be harmed I don't know, because harm is a comparative concept. So to harm someone means to make someone worse off. But worse off compared to what? To what this person would otherwise be in the situation, to what this person might have been in the future, to what this person is entitled to be. The answer to this question might be different. Now, take, for example, the case of challenge studies for COVID-19. So there was a lot of discussion during the pandemic about this. Now, the first vaccine that came out, they were not tested through challenge studies, but there was a lot of discussion about accelerating vaccine discovery back then through challenge studies. Now, if you infect someone with COVID-19 to test a vaccine, are you harming this person? Well, it depends, because you might remember at some point everyone was getting infected. We all got infected, most of us, multiple times, presumably many of us got infected multiple times without knowing it. Now, if you infect someone in a controlled setting, I suppose this person becomes sick with, that's worst case scenario, this person becomes sick with COVID despite the vaccine. Are you harming this person? Well, it's not clear to me you're harming this person, because this person most likely would have been infected anyway. Actually, it's better to be infected in a controlled setting than outside, right? So doesn't mean that maybe we should have more challenge studies, infect people more in controlled settings. During the pandemic, someone suggested we should infect people on purpose with COVID to build immunity, for example. I don't know. If you get COVID anyway, you might want to get in a controlled setting. I don't know. That's just to say, I'm not saying we should do that, so sorry, I should be clear, because also this is recorded. I'm not saying we should go infecting people. I'm saying that the concept of harm is very complex once you start thinking about what it means to harm someone. So one thing that this implies is that maybe, for example, challenge studies are more ethically permissible in context where a certain disease is endemic. Because if a disease is endemic in a certain context, the participant you might have would likely get infected anyway. So maybe there is a stronger argument for challenge studies in endemic context. That's also a problem, because some diseases are not endemic. But then you might want to think about other cases where we might need challenge studies to test vaccines. So for example, at some point, we might well need a new vaccine against smallpox. No one has smallpox these days, but there is smallpox somewhere in some labs in some countries. Now, given the current political situation, risk of bioterrorism, suppose at some point we need a vaccine against smallpox. How do you test a vaccine against smallpox? Maybe you infect people with smallpox to test the vaccine. That's very unclear. Some people suggest for these kind of things we can use the military, because it's often a matter of national and global security. That's a terribly complicated question. But suppose someone volunteers to be tested against, to be infected with smallpox to test a vaccine. Should that be permissible? So this person gives informed consent. That's a complicated, I don't have the answer, but that's the type of answer at some point we might need to ask. I'm taking smallpox because it's an extreme example of an extremely lethal condition, but you can think of other kind of diseases where a version of this question at least arises. And that's where we need to think ethically about, okay, what are the ethical issues here? Do we care ethically about consent? So if someone consents to take on themselves large risks for the purpose of helping vaccine research, should that be ethically permissible? And maybe we should reconsider what I said at the beginning. Maybe there are some limits to what we can do to people in order to bring about a greater good. But if we can save millions of lives, like by preventing smallpox through a vaccine, and some people is volunteering to test the vaccines to be infected with smallpox, should we do that? Maybe there's a case where we should be utilitarian after all. I'm not saying that we should. I'm saying that there is a question there to be asked about to what extent we should limit the level of harm we can legitimately expose participants in the research. This relates to something else I wanted to say. So can you, because I don't know how we're doing with time, so when you think that I should stop in 5 minutes or something, because I have a timer here, but maybe I can go for 5 minutes, okay? Yeah. So I wanted just to point out the various phrasings that are used in the various versions of the Declaration of Helsinki, which you might remember says that research outcomes are important, the most important, but they should never take precedence over what? Over two things. So the phrasings has changed slightly historically, but it's not really a slight change, it's a significant change. So the Declaration of Helsinki mentioned different things. Initially mentioned the interest of participants, then it mentioned the well-being of participants, and then it goes back to mentioning rights and interests of participants as things that need to be prioritized over the outputs of research. Now, for most practical purposes, these things mean the same thing, but not when it comes to vaccine research. So if we say that we should prioritize the well-being of research participants, it means we should prioritize the health of research participants. If we think we should prioritize the interests and rights of research participants, it means we should prioritize the autonomy of research participants. And these things can be very different because someone might autonomously choose to put their health at risk, for example, for research. During COVID-19, you might remember, or you might know, including at the beginning, when it was really unclear what the risk of COVID were, there was a lot of uncertainty. There was this organization in England that formed of people that were volunteering to be infected with COVID-19 to test the vaccine. It was called One Day Sooner, to test the vaccine for challenge studies. And that, was quite interesting because back then we really didn't know exactly how dangerous COVID was, including for young people. So should that be allowed? Should autonomy prevail over health? So after all, it's true, we have a right to health, but rights usually are the kind of thing that can be waived. We can say, okay, I'm happy to give up on that in order to promote research. If there is money involved, if you pay me £5,000 to be infected with COVID, I prefer to get £5,000 than to remain healthy. I'm happy to do that, maybe because I need money. Should that be allowed? So in this way, we might be promoting autonomy, but not the health. So we need to make a decision which principle we need to prioritize. And that's a difficult question. People might say, well, if there is money involved, that's not really autonomy because large payments undermine informed consent, undermine perception of risk. You're not really, your judgment is distorted. But again, I don't know how strong an argument this is because we often allow people to be paid a lot for taking on extra risks. There are risky occupation, risky jobs where people are paid a lot. And we're perfectly fine with that. They're paid a lot because of the risk. So why is the research different? Some people talk about research exceptionalism, so medical research is different. I don't know about that, but that's something. I have to say, in the last 50 years, autonomy has become the central principle of medical ethics and research ethics. So, and that's why I struggle to find in the bioethics literature a paper that is against challenge studies. Everyone is in favor of challenge studies in the bioethical literature because autonomy is the core principle. If people voluntarily choose to enroll and get infected, that's what autonomy implies. I suppose, I have another example, but I suppose in the interest of time, because we start a bit late, I can stop here. I'm happy to go through or to answer questions. This is a short summary of the main take-home points that I mentioned, but yeah, I leave the slide there, and I think I can stop here. Thank you very much.
Great, thank you for an excellent talk, and we've got time for some questions. Anyone wants to come up to the mic? Yes, start on there.
Thank you very much for an excellent talk. I have two quick questions to ask. We've been doing a lot of work also on the ethics of controlled human infection studies, and I've been debating this a lot with the volunteers, who apparently they have very little voice and not really a stage because they're anonymous. So on their behalf, I would like to ask you, what do you think is the difference between informed consent to a phase 1 study, where there's also healthy volunteers taking a risk, and a challenge study? And the second question is, what's the difference between people taking part in a chimp study as compared to a firefighter, who's also
what, sorry?
To a firefighter,
Yeah.
who's also paid to take risks and, for other people's well-being?
Yeah, thank you. So about the first question, my answer would be, many people might disagree with me, is that there really is no difference between the phase 1 and challenge study or later phases. Because, so we're talking about informed consent. So what changes the nature of the information you provide? So in the first case, you have to provide more detailed information about the risks, the safety. And in the latter case, it's more about the effectiveness. But if we really care about informed consent, I would say it's the same thing ethically, as long as you provide the information. My guess is they will be less likely to find more volunteers for the first type than the second. I don't know, but informed consent is precisely about providing the right information, if we care about informed consent. If the implication is that people might end up enrolling trials that we consider too dangerous, well, I think at that point we need to make a choice whether we do care about informed consent or not. Maybe say, okay, maybe there are other principles. Safety maybe matters more than informed consent. Then we need to make a decision about what principles we prioritize. But in terms of informed consent, I don't think it makes a difference. And the second question is that's a great question, because I mentioned it about this thing about research exceptionalism. So that's an analogy that's often used. We pay firefighter more for the risk they take. I don't know if we do. Maybe firefighters is not the right example, but suppose, there are some jobs where we pay people more for, I think firefighters are often underpaid, but I don't know. Sometimes we pay people more for risky jobs. So is a role in medical research the same as a job? Is similar enough to a job, an occupation? You're paid for taking on risk. My view is that yes. My view is the same thing. Many people will disagree with me, but I think that's a very good question.
Yeah, I think it's an interesting question as well, because we're not allowed to pay for risk, right? We're allowed to compensate financially for time, but never for risk.
Yeah.
So you don't pay people for risk, but I guess a firefighter would be paid extra if it's really risky, or I don't know about people that sort of take away bombs and so on. I suppose they'll be paid for the risk.
Yeah. So I wrote a few papers about paying participants in challenge studies for risk, which is what many people are not opposed to. I co-authored one paper with Andy Pollard about that as well. There is a big question there. Should we pay participants for the risk, not just for time and inconvenience? I think we should ask this question. Yes.
Hi. So, in context to pandemic and epidemic settings, what are the key ethical consideration, for faster preparation of vaccines? So when we are doing kind of a bridging and using different other innovative designs, adaptive trial designs. In those settings, what are the key ethical principles that one needs to take into consideration in order to strengthen faster vaccine development?
Yeah, a pandemic context is particular because, for most pandemics, I would think if it is likely that people will get infected anyway, that would be an ethically relevant factor, because that provides stronger justification for challenge studies, according to my argument. Because people will get infected in controlled settings, which is better than getting infected in the real world. But so the real point is that it's unclear that you will add additional risks onto participants if those participants will get infected anyway. So that would be one consideration. Most obviously pandemics, by definition, affect the whole world. So there is a bigger interest in developing faster vaccines. So what is at stake is bigger in an important sense. That would be the two main considerations.
But for the country, for the LMICs who would not particularly participate in CHIM model, for them who will want to do an accelerated development.
So I think that problem is very complicated, because there are two types of consideration. One is that, of course, you want to run experiments and test on different population groups, because there might be difference in how effective treatments and vaccines are. Often there is also the opposite problem. Some people will be very concerned about testing or infecting people in contexts that are already suffer from a lot of injustice and fairness at the global level. So some people will see that kind of thing as problematic for other reasons. So if you say we should do more challenge trials, for example, in certain low and middle income countries in Africa, many people will not really accept that, and perhaps for good reasons. So there is this kind of tension between effectiveness but respecting and also taking into account current injustice globally. So I don't have the answer. I'm afraid that I ask questions, I don't have the answer. I just maybe reformulating questions. I know that's frustrating, right? Yeah, thank you.
Thanks for raising all the complex questions. So I'm Chris Chu. From Imperial College London, I led those first SARS-CoV-2 controlled human infection studies, and so obviously had a lot of involvement in thinking through these ethical questions. And I think that, this is really a comment rather than the question, but I think the difficulty has always been that the questions are kind of left hanging in the air, and it makes it very difficult for actual researchers to progress. And I think that's sort of been exemplified by your talk as well, that there are lots of questions which you've not really been able to answer. And I think the pandemic really helped us solidify some of that, because it was a relatively extreme example of these kinds of ethical questions. And so there is WHO guidance now, published WHO guidance on the ethical principles surrounding controlled human infection models, and I think that's really valuable, and I would encourage people to look at that. I think I don't know if you agree, but I think these ethical questions are very context specific. And so the important point, maybe, I'm sure you covered it, but I just wanted to sort of highlight, is the importance of engaging with your local population, the potential volunteers, but also the wider society around them, the investigators who are running these studies, because the vast majority of investigators, all I would say, are highly responsible clinicians who understand the ethics of patient care, and there are, certainly there are legal boundaries to what you can do in terms of harm to others. Just because somebody has informed consent and to having their leg cut off for fetishistic reasons doesn't mean that doctors are exempt from prosecution for that. So there are already limits kind of built into systems. But really, I think it's about making sure that there is sufficient consensus within the research community, the society at large, ethical bodies and regulators who are overseeing these studies, and perhaps that is enough guidance for us to be going on with.
Yeah, it's not a question, but I think I would agree with most of it. There is this tension. Your example about chopping off legs, for example. I don't know. We need to decide how much we value informed consent. So, is informed consent the thing that matters the most, or should we have boundaries on the kind of harm we can impose? To me, that's the question. Now, I raise question. I do have my views, my answer to that. But I think the relevant point here is that who should answer these questions? So it's not me as an ethicist. It's not doctors. It's not scientists. I'm not sure it's the WHO. So because these things, as you said, is very much culturally, so it's very much context dependent. All the guidelines we have are the result of historical processes. Often they are the result of previous horrible practices that we try to prevent from happening again. So everything is historically situated. So to me, maybe the general question is, okay, who is going to, I ask the questions, I have my views about that, you have your views, but who answers these questions in a way that then can inform research? The WHO has guidelines on various things. WHO is made by humans. Different people in WHO might disagree about what the right guidelines is. These are kind of often a compromise thing. So to me, the question is who answers these questions? And I don't know. It's not me, of course. I don't know who answers these questions. Thank you. I think we have...
Great, thank you. I think we've reached the end of time. So thanks again for an excellent talk, and thanks for all your participation.
Thank you very much.